Hello, my name is Margaret and I'm a student in the Eastern Kentucky University's Rural Nurse Practitioner program. For my advanced practice nursing project in NSC 892, I researched the healthcare problem of youth athletes with concussions and post-concussion symptoms. Sports-related concussions in youth athletes have been in the media spotlight over the past decade. The CDC reported that the rate of emergency department visits among children, those who are age 19 or younger, more than doubled between 2001 and 2012 for sports and recreation-related injuries, receiving a diagnosis of mild traumatic brain injury or concussion. While prevention of injury is the focus of much literature surrounding this hot topic, treatment is just as important. Traditionally, the treatment for concussions in pediatrics has been physical and mental rest for up to 10 days following the injury. Current scholarly research shows better outcomes with a shortened rest period for up to 48 hours, followed by an active rehabilitation program. These programs can include aerobic exercise, physical therapy sessions, and specific types of stretching. The purpose of this project proposal is to introduce an evidence-supported intervention to a clinic treating post-concussion syndrome in youth athletes. Implementation of the proposed project is considered safe as found by the reviewed articles. As the outpatient clinic environment evolves, advanced practice nurses will be central in developing evidence-based practice cultures. I reviewed 4 studies pertaining to the safety and effectiveness of these active rehabilitation programs. A Level 1 study conducted by Schneider and Associates in 2017 reviewed 28 studies with a purpose to analyze data that evaluated the benefit of rest after a concussion and how long the rest period needed to be. Also examined studies including evidence supporting active treatment and rehabilitation for the population of youth and adults. Findings include better outcomes with limited rests of 24 to 48 hours, followed by structured and progressive activity and rehabilitation, rather than the strict rest for an extended period of up to 7 days. Another systematic review, this one by Ballard and Associates, examined the effect of physical exercise on multiple outcomes in patients with concussions. 14 studies were evaluated, and the research findings of improved concussion symptoms with physical exercise has significant evidence-based support. Chan and Associates conducted a randomized controlled trial in 2018 with a sample size of 19 adolescents, evaluating active rehabilitation with persistent post-concussive symptoms. The primary aim of the study was to evaluate the safety of active rehabilitation with graded aerobic exertion with systematic surveillance for acute and subacute adverse effects. Chan and Associates found a significant effect that supported that active rehabilitation is a safe intervention in treatment of adolescents with persistent post-concussion syndrome. Hunt and Associates in 2018 collected data for a qualitative study to analyze the experience youth and their parents had with an active rehabilitation program for youth athletes with post-concussion syndrome. The study group suggested that the findings from this study could be useful in individualizing active rehabilitation programs in youths with concussions to optimize their outcomes. They conclude that education on managing energy while engaging in supervised physical activity is a significant factor in the youth perspective active rehabilitation programs. They also revealed that in the case of the parent perspective, identifying how their child can be more accountable for their recovery and accepting unsure timelines for the recovery is beneficial. The implementation of this project includes the following methods: an interprofessional team of advanced practice nurse, a physical therapist, and a medical assistant. And in this case would be led by the primary provider, which is the advanced practice nurse in this clinic. The population of the study participants are pediatrics, and they are considered a vulnerable set in the population, so city training would be required for all interprofessional team members. To identify the patients that are suitable for participation in this project, screening will take place with potential participants by completing a post-concussion symptom scale. Once participants are identified, the youth athletes and their parents will have an initial consultation with the interprofessional team that fully educates them on the 6-week program and reviews their specific participation obligations. The active treatment plan will then begin with sessions with the physical therapist that include at-home activities. Weekly check-ins by phone will be conducted by the medical assistant every Friday. At the end of the 6-week active rehabilitation program, there will be a post-project consultation with the interprofessional team and the participants that will include a second completion of the Post-Concussion Symptom Scale, or PCSS. The span of the project, including preparation weeks and analysis of evidence, will take place from August 1st to November 1st. The findings of the intervention project will be reported to the stakeholders, which in this case are the clinic practice managers and those practitioners that are treating youth athletes with concussions. The participants will also be informed. Following this initial project, 2 to 3 more trials of the intervention should take place in the clinic over a 12 to 18-month period. The intervention could also then be expanded to different age groups or different mechanisms of injury. Findings of the project can then be discussed in a scholarly article and presented at conferences pertaining to treatment of concussions in youth athletes. The Post-Concussion Symptom Scale is the measurement tool used to determine presence, improvement, or worsening of symptoms experienced by youth athletes with post-concussion syndrome. The outcome expected of this project is an improved PCSS score for each participant that proves safety and effectiveness of active rehabilitation programs for youth athletes suffering from concussion and post-concussion symptoms. Thank you for listening to my project proposal. Have a great day.